a doctor yourself and an expert who actually has been living and working in China for a long time, working with hospitals here in China. Tell us a little bit more about your experience and your knowledge when it comes to hygiene.
Hygiene. Well, okay. Let's just cut to the chase. COVID was a very good example of that. How to sneeze, how to wash your hands, social distancing. I mean, these are things that have been around in the market for a long time. But it took an event for people to recognize that spitting on the ground is not healthy, coughing out in the open isn't healthy. Washing your hands is important. Public areas need to be sanitized and clean, right? So it took something like that to create attention, right? And so even in hospitals, I was like 20 plus years in the US before coming to China in hospitals. And even there, the standards are, even when wiping down surfaces, wiping down different areas, you have different cleaning material and cloths to wipe it down. You're not using a counter towel to wipe, you're not using the floor towel to wipe on the counter, that kind of stuff, right? And so even in that case, when I came to China, certain hospitals that were already more westernized were doing that. But if you go to some of the different areas of China, or tier 2s or tier 3s or even sub tier 1s, I mean, they were using a bar of soap, right? And everybody shared that. They were using one towel to wipe their hands, and everybody was sharing that. And from a sanitary standpoint, it's cleaner than not washing your hands, but it's not clean, right? And it's actually potentially spreading diseases, right?
Are you able to tell us a bit about what are some standards that hospitals here in Shanghai would follow when it comes to hygiene?
Well, I mean, again, I think that washing hands per every patient, right? And then there's I can't remember the amount of seconds that you're supposed to be washing hands, but I always remember this from school is you say row your boat twice. And that should be enough times for I think at least 20-30 seconds of
row your boat.
Yeah.
You say this twice while
you're
washing
your hands.
You say it twice,
and then while you wash your hands, and that it's an easy reminder. And after once you've done it, then you're done. Right.
I think everyone can do this at home.
Right,
That's simple.
Yeah, I mean, even if you go fast, it's still, you say it enough that it's enough time to be able to wash your hands, right? And even in that sense, there's a way to wash your hands, right? In a hospital, using friction, right? And people forget that it's not just putting soap and then just letting the soap just run off your hand, right? You have to actually use friction in order to be able to get that done. So the standards, we use Joint Commission, which is a U.S. standard, or there's DNV, which is a Norway standard for hospital accreditation, and then there are washing and cleaning standards and things like that. But again, washing your hands in between patients, being able to, if there is a respiratory infection, depending on what type of infection it is, isolating a patient. So this whole thought during COVID about social distancing, we've been doing that for many years already. I mean, it's just that, and people, let's just say in Western countries, we're just used to knowing that. Okay, well, if you're coughing, then we'll keep away from each other. But here, everybody's so close. One of the biggest issues that I realize is that there is no barrier between people, right? There is no I need my space, right?
Different culture, yeah.
Different culture. So for example, when you're in the subway, right, you just packed in and squeezed in. Like when you're walking, I joke around with a lot of people. I says, why is it when I'm in the subway, no matter if there's this big hallway, people still find a way to hit you, right? And you could walk on the other side, but you decide to cut the corner and hit. But see, that's just the way. There's no space relationship in certain countries, right? And China's one of them, right? And so in a sense that what we know, maybe in Germany or in the US, there's a certain space standard that people are usually comfortable with, and that's what we stay with. And if you cough, you're coughing with your hands over your mouth, right?
Or
I mean,
your
no,
elbow
your shoulder,
nowadays.
not with your hands anymore. But your mouth, your hand is better than nothing. But it should be your shoulder now, right? And things like that, right? And even in the sense, people think that cleanliness is actually using hand sanitizers, right? But hand sanitizers is just the option for not being able to wash your hands, right? Because washing your hands is still better than hand sanitizers. And actually, in some places, they realize that the water cleanliness has gone down and the water safety has gone down because of hand sanitizers. Because they use the hand sanitizer, and where does that go?
Oh.
Right, it goes into the water system, and then it kind of messes with the chemicals and things like that. So there have been some studies to show that the overuse of hand sanitizers over washing hands has actually made it sometimes a little bit not safe, right?
Okay, so it's better we wash our hands in a proper way and also with friction,
right,
and
with
long
friction
enough, and soap,
right,
instead of using hand sanitizer.
Right.
Wow.
Right. And then again, even with the types of water that you're using, like I never, be honest, it's not only until China I came that I really cared about, okay, when you're in the shower, please, don't swallow the water. I never thought about, in the US, we don't think about that, right? It's all filtered in some way, so we never say don't swallow the water. I mean, it's just something that you just don't talk about. Here, it's like even a reminder in some of the hotels, this water is not to be ingested, right?
I never thought about this.
Yeah.
I've never seen this in hotels, actually.
This
you
was like
shouldn't swallow the water while you're taking a shower.
2008, I remember that when I came here, and I was at one of the, I don't want to say the name, one of the top, 4 or 5 star hotels, right, in Beijing. And it says there, the sign says, this water is not to be ingested.
Okay, it's not that I swallow it, but I never would have thought about it, to be honest.
Right, and neither did I. But then there was a sign there that said this. I'm like, how unsafe is this water?
Because actually, when we brush our teeth, we would sometimes, we call it gurgle.
Right.
Yeah.
Gargle, yeah.
Gargle.
Yeah.
And you would also have the water inside your mouth, and although you spit it out.
Well,
so is that not safe either then?
Well, I mean, everything in moderation, I think, okay. Not even said moderation, you're not using it to actually drink, right? But if you actually ingest a little bit of it on, as per chance, I don't think that's an issue. I think they just don't want you drinking it.
Yeah.
Right?
I see.
And so I think that's why they said when they say ingest it, don't use this as drinking water.
Yeah.
There's a separate drink. There's separate places where you can get that in your hotel room, or ask for water. We'll give you water. Don't drink the bathroom water.
And talking about, you work with hospitals, as I can see, they're more like a joint venture, like an international, like an American brand, fusioned with a Chinese one or so. So I guess more like the luxury hotels. Can you say anything about the different kind of standards also in hygiene for the different types of hotels that we have here?
Hotels or hospitals?
Sorry, hospitals. Yeah.
Again, we're using. In 2008 when I first came, right, there were about 3, maybe 4 hospitals that were quote unquote international accredited, using the same standard that we would, using the same standard but maybe a lighter standard than what we use in the US, right? And the reason why that is because a US standard is not the same as a China standard, meaning that there's a cultural differences that you have to abide by.
Yeah.
And so we call it, it's an international standard that's a little bit lighter because you have to remove all the cultural normalities from a country, right? So in a sense, we were using those standards, a Western standard, to be able to ensure safety and quality, right?
Yeah.
And a lot of that was cleanliness. For example, like I said, even in the respiratory rooms, that infection rooms, right? Ensuring that the doorways were sealed if there was somebody sick inside, so that the air can only stay in that room; it doesn't go outwards. So it was properly sealed, vacuum sealed. Where was that, in a sense, where was that air going? Was that air being purified? Things like that. So these are the kind of the standards that were that were inputted into these quote unquote international organizations.
And for me, if I choose my hospital, hopefully I don't have to go, but is there something that I should keep in mind when I choose a hospital? I mean, of course, my insurance would give me a list of hospitals that I could choose from, but is there something like hygiene-wise that I should have in mind before I choose the hospital or before I go, or I don't know?
I mean, it's of course, like what everybody says, right? Why do people choose hospitals, right? Usually, number one, it's the doctor that's there. I hate to say that, that's always a choice. People don't realize it, but it's always, they believe that the doctors there are, quote unquote, the best doctors, right?
Okay.
So usually, number one is the doctors. Who are the doctors in that hospital, number one. Number two is quality and safety. Am I safe going to that hospital, right? And cleanliness is part of that. You know, when I go there, am I going there getting a nosocomial infection, which is basically a hospital-acquired infection, right? Or am I going to go there knowing that I'm not going to get sicker, right? And so, are there hospitals better than others? See, I don't like to rate them. I don't want to say public hospitals are not as safe as international hospitals. I think that we all try to be safe. I think the issue is with public hospitals, at least in China and in the US, there are just so many people that come through those systems. It's hard to keep the same level of what you say quality and safety as a hospital that's super busy. So like a hospital where a doctor's seeing about 50 patients a half a day, like 100 patients a day, versus a doctor in a private hospital who's only seeing maybe half of that or a quarter of that, is one hospital safer than the other? I would say based on number of patients, it should be safer. Right? But again, a private hospital just because it's a private hospital doesn't mean that it's always safe, because maybe they're going to cut corners, right? Because versus a public hospital who's fully funded versus a private hospital who's reliant on patients walking through the door or private funding, right? They don't get government support in China, right? For funds, right? So in this kind of a situation, maybe then private hospitals sometimes are not as safe. So again, it all comes down to being aware.
Yeah.
You have to be aware. Number one, like I said, is like people like to say that hospital hotel, kind of like, you know, when you go to a hospital, you should get if good quality service means that you're getting like hotel type of service. That's not necessarily the case. Even a lot of hospitals I talk to, I say, look, they're not coming to this hospital because it's VIP and super nice, right? They want to first doctor. Number two is, are they going to be safe?
Yeah.
Right. If it's clean, that's even better. Right. When I say clean, I mean there's not mosquitoes flying around. There's there's no dead bugs around. There was a patient recently that it said he went to one hospital, which was a private hospital, right? But like in a sub-region of Shanghai, right? And he said, I got to get out of here because there's dead bugs all over the floor.
Oh, wow.
And stuff like that, right? So, and in a sense that, he's using his insurance to pay for this. Why am I here, right?
Yeah.
I should be somewhere else.
Yeah.
Right? And I'm like, yeah, why are you there? Right? So, there are much better places to go to, even public hospitals that are much better than this situation.
And that's a very important detail. It's a small thing with the bugs, but something that we can all watch out.
It is, right? And so, for example, like in other organizations in the past, they were using a very similar model. Again, it's not right or wrong, but the public sector has a different way to deal with how to do the finance with patients, right? So when you go to a public hospital room, right, you have to pay for everything. Like when you go to a room, you're only paying for the room, but you're not paying for the paper towels, you're not paying for the water, you're not paying for anything, right? Versus private hospital, when you go to a private hospital, you should be getting all in one because it's more expensive. So you should be getting the bed, the nurse, the doctor, the amenities, right?
Yeah.
Some private hospitals kind of like, well, okay, we'll go a little bit cheaper, but I'm going to cut all that out.
Yeah.
You have to be aware of that.
Yeah.
Just because it's private hospital doesn't mean a private hospital has the same standard across the board.
Yeah.
Even in a public hospital, there's at least tier 2, not tier 2, level 2, level 3 hospitals in Shanghai. Level 3s are not the same as level 2s, right? So they're different standards.
Wow, good to know.
Right, so that, I mean, you have your Huashans, you have your Renjis, you have your Hygiene, you have your Tongji, you have your Tongren Hospital. These are level 3 hospitals. You have people's number 1. So these are your top hospitals. You should be getting top of the line doctors there, right? Good diagnoses. They're going to be super busy, right? But then you go to like Zhoupu or some of the smaller hospitals, right? And they could be backed by a Tongji or Tongren or Fudan, right? But they're not the same level hospital, right? They're a different level hospital. And so in this kind of a situation, they may not have a VIP section. They may not have an English speaking section. So then you go back to thinking about, well, if that's the case, well, how about quality and safety? Well, you would assume that quality and safety is the same, but it may be not, because maybe that's not their focus. That's not their, it's not that they don't want to focus on it, it's just, maybe they just don't have the capacity to focus on it, right? It's not that they don't want to, it's that maybe they don't have the capacity to be able to seek for that, right? Because they don't have the, number one, they maybe not have the manpower or the knowledge base, the people around them to be able to do that. Because quality and safety is not just one doctor, not one nurse, not even a team,
the whole organization.
Right? So people said, oh, VIP should be super quality, so we should be a good hospital. Yeah, but your VIP section should not be the only part of the hospital. It should be the whole hospital. Right? So like, there was even an organization that I was helping to help them with their quality and safety, and they said, well, okay, you can deal with the international section, but don't you want the whole hospital high quality and high safety? Why is it you only want to do this in the international section? So are you saying that the rest of the hospital won't follow the safety standards that we're trying to hold in the international section versus the rest of the hospital, right? And then the excuse was, we just don't have the capacity to be able to do that, right? Because, controlling one small area is much easier than controlling a bigger area. When you control a bigger area, there's a lot more, there's not necessarily a responsibility issue, but there's a manpower issue and just a throughput issue that you're dealing with. And that's where the public hospitals have an issue with that.
Yeah. So thank you so much for your time now. I hope you guys enjoyed it.
Yes, thank you very much.